Gout is by far the most common use for dual energy CT and MSK. And with the latest generation scanners, actually, the gout images can be auto-processed, making it very easy. Some other common applications include bone marrow imaging and metal artifact reduction. But gout still is the main use for dual energy CT in MSK. So dual energy CT is actually pretty accurate, sensitive and specific for gout, but the sensitivity actually drops quite a bit in the acute setting. So when there's an acute gout attack and you perform a dual energy CT, you may not see it lighting up for gout crystals. In that case, looking at your non-contrast CT, looking for erosions and hyperdense soft tissue deposits can help increase the sensitivity. Dual energy CT for bone marrow imaging has actually become more used over the last few years as dual energy CT scanners have become more available. And it's very useful in detecting occult fractures such as vertebral fractures, hip fractures, and wrist fractures. A couple of things to keep in mind when performing dual energy CT for bone marrow imaging is that it can only be done on non-contrast examinations, and it tends to work better in older patients that have mostly fatty marrow. In patients with a lot of red marrow, such as young patients, it tends to be less accurate.